Hydraguard-D 12.5 Topical Cream is used to moisturize and treat dry, rough, scaly, itchy skin, as well as minor skin irritations like diaper rash and skin burns from radiation therapy. It contains emollients that soften and moisturize the skin, reducing itching and flaking. Some ingredients, such as zinc oxide and white petrolatum, also protect the skin from irritation. Dry skin occurs when the upper layer of the skin loses water, and this cream works by forming an oily layer on top of the skin to trap water in. It contains common emollients like petrolatum, lanolin, mineral oil, and dimethicone, as well as humectants like glycerin and propylene glycol to draw water into the skin. Additionally, it includes ingredients like urea, alpha-hydroxy acids, lactic/citric/glycolic acid, and allantoin to soften the top layer of skin cells, helping dead skin cells to fall off and leaving the skin feeling smoother and softer. Be sure to use this product as directed and follow all the instructions on the product package. Some products may need to be shaken before use, so check the label to see if this is necessary. Apply the cream to the affected areas of the skin as needed or as directed by your doctor. The frequency of application will depend on your skin condition. For dry hands, you may need to apply the cream every time you wash your hands throughout the day. If you are using this cream to treat diaper rash, make sure to clean the diaper area well before applying the cream. Allow the area to dry before application. If using the cream to treat radiation skin burns, check with radiation personnel to ensure it can be applied before therapy. Apply the cream only to the skin and avoid sensitive areas such as eyes, mouth, nose, and vaginal/groin area, unless directed otherwise by the label or your doctor. Be sure to follow all the directions on the label for proper use and consult your doctor or pharmacist for more details. Use the cream regularly for the best results. Apply it after bathing or showering while the skin is still damp. For very dry skin, your doctor may advise you to soak the area before using the cream. Remember that long, hot, or frequent bathing can worsen dry skin. If your condition persists or worsens, or if you suspect a serious medical problem, seek medical help promptly. When using Hydraguard-D 12.5 Topical Cream, it is normal to experience some burning, stinging, redness, or irritation. If these effects persist or worsen, it is important to inform your doctor or pharmacist. If your doctor has prescribed this medication, it means that the benefits outweigh the risks of side effects. Most people using this medication do not experience serious side effects. However, it is important to contact your doctor immediately if you notice any unusual changes in the skin, signs of skin infection, or symptoms of a serious allergic reaction such as rash, itching, swelling, severe dizziness, or difficulty breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, it's best to consult your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Hydraguard-D 12.5 Topical Cream, make sure to let your doctor or pharmacist know if you have any allergies to the ingredients in the product, or if you have any skin cuts, infections, or sores. Some ingredients in the cream may make your skin more sensitive to the sun, so it's important to check the label for any warnings and ask your doctor or pharmacist if you need to take any special precautions when outdoors. Your doctor may suggest limiting your time in the sun, avoiding tanning booths and sun lamps, and using sunscreen and protective clothing. If you get sunburned or have skin blisters or redness, be sure to let your doctor know. If you have acne-prone skin, look for the word non-comedogenic on the label to make sure the product won't clog your pores. Also, be aware that some products may stain or discolor clothing, so it's a good idea to ask your doctor or pharmacist for more details. Before having surgery, inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, consult your doctor before using this product. It is not known if this product passes into breast milk, so it's important to have a discussion with your doctor, especially if you are applying the cream to the breast area. It's important to be aware of potential drug interactions, as they can affect how your medications work and increase the risk of serious side effects. Be sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's essential to always consult with your doctor before starting, stopping, or changing the dosage of any medicines. This will help ensure the safe and effective use of Hydraguard-D 12.5 Topical Cream. Remember, this medication should not be ingested. If someone accidentally swallows this cream and experiences severe symptoms like fainting or difficulty breathing, it's crucial to seek immediate medical attention by calling 911 or contacting a poison control center. In the US, residents can call 1-800-222-1222, and in Canada, residents can contact their provincial poison control center. Always keep this medication out of reach of children and pets. When it comes to preventing dry skin, there are a few simple steps you can take. First, try using lukewarm water instead of hot water when bathing, and consider taking baths or showers less frequently, like every 1 to 2 days. When you do bathe, keep it short to avoid drying out your skin, and consider using a humidifier if the air in your home is very dry. There are various emollient products available to help with dry skin, including ones with fragrances or other ingredients that some people may be sensitive to. These products come in different forms such as oils, creams, lotions, or sprays. It's best to consult with your doctor or pharmacist to find the product that may be the most suitable for your needs. If you forget to apply the Hydraguard-D 12.5 Topical Cream at your regular time, just apply it as soon as you remember. Do not apply extra cream or use it more frequently to make up for the missed dose. Make sure to check the storage information on the package and consult your pharmacist if you have any questions. Keep all medications out of reach of children and pets. Avoid storing the foam canister near high heat or open flames, and do not puncture or burn the canister due to the pressure inside. Do not dispose of this product by flushing it down the toilet or pouring it into a drain unless instructed to do so. Properly discard the product when it is expired or no longer needed, and you can consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.